Hello, my name is Emily Pegues, and I'm a student in Nurse Executive Health Systems at Research College of Nursing. Today I'm here to review the book The Cost of Cutting by Dr. Ruggiera. Dr. Ruggiera is a surgeon who has previously authored a book called The Confessions of a Surgeon. In The Cost of Cutting, Dr. Ruggiera attempts to expose the hidden flaws of our current healthcare system. As he reviews in the introduction, there is a new conversation going on in our country about money and healthcare. While the Affordable Care Act has imposed urgency on this conversation, the cost of healthcare has been rising for several years. In the United States, we currently spend $2.7 trillion on healthcare each year. That figure accounts for 17% of our gross domestic product, which is more than any other country in the world. Dr. Ruggiera, with a background in surgery, knows that surgery accounts for big revenue for hospitals. Currently, 50 million surgeries are performed in the United States each year. While hospitals, surgeons, and ancillary care staff must be paid and make up the cost of performing the surgery, operating rooms produce a large profit for surgeons and hospitals. Dr. Ruggiera reports in the book that $150 million are spent on unnecessary surgery costs each year. Today, it is estimated that 10 to 20% of surgeries are not needed, which naturally leads to the question, how is all this time and money spent on unnecessary surgical procedures, and is this a flaw in our healthcare system? Dr. Ruggiera reviews one possible cause of this unnecessary surgeries are performed. This can simply be requests from the patients. There are several examples listed in the book of patients who simply felt, why not just go ahead and take it out? I don't need it. From my history of working as an emergency room nurse, we've all seen patients who just simply know that there's something wrong. Why not take me to the operating room? Take a look, see if there's anything going on. One of the most interesting reasons Dr. Ruggiera discussed in the book as to why these unnecessary surgeries are done has to do with the increase of incidental findings due to the advancement of imaging services. The usage of CT scans was a mere 3 to 4 million scans a year in 1995. Just 15 years later, it is estimated that 70 million CTs were performed for the year 2010. A different report showed that there was a 400% increase in the usage of MRIs. What does all of this mean for increased surgeries and surgery costs? The increased use of the very sophisticated imaging tools can lead to incidental findings. What this means is the CT or MRI finds something that is not the reason the patient had the CT or MRI, but nonetheless, the radiologist reports it, it can lead to a surgery referral, and eventually a surgery. Another possible reason is the declining rate of reimbursement. In one example reviewed in the book, a colonoscopy would be reimbursed for $1,200 by a private insurer 15 years ago. Today, that exact same procedure would be reimbursed for $350. In another example, cardiac surgeons have seen their reimbursement rate for heart bypass decrease a whopping 200% in the last 15 years. To break this down even further, Medicaid reimburses at a rate of 29 cents for each dollar billed. Medicare may reimburse up to 38 cents for each dollar billed. This is a stark contrast compared to the private insurers who may reimburse up to 60 cents per dollar. The poor reimbursement rates by government insurers has created a new problem for our healthcare system: surgeons who cherry pick based on the patient's insurance coverage. While no one wants to believe a surgeon would put a patient through an unnecessary surgery just to bill for it, cherry picking patients based on private insurance to ensure a higher reimbursement rate may be necessary for survival for some private practice physicians. As if the reimbursement rates weren't incentive enough to cherry pick, another reason this practice is encouraged is due to the enormous labor-intensive act to bill the government insurers. Some estimates in the book include an overhead of 60 to 70% of a private practice's revenue just to provide the clerical work to bill the government insurers. It is understandable why some private practice physicians might want to limit the number of Medicare or Medicaid patients seen by their practice. The next topic Dr. Ruggiera tackles is the increasing trend of surgeons to work for hospitals rather than go into private practice. Some of the statistics reviewed in the book report that 68% of surgeons are now employed rather than being self-employed. The statistics saw a 32% increase from 2006 to 2012. Dr. Ruggiera states a concern that this trend could have a negative impact on the quality of care delivered, that this trend now means that the surgeon has a financial impact or a tie to make money for the hospital, rather than just him or himself through the private practice that he's employed through. This argument never quite reached its full potential for me. For instance, while I can see that a hospital employed physician will have more people to answer to, I don't believe that it's logical to say that a surgeon might be more prone to do surgery on a case that doesn't need it simply because a hospital administrator wants them to. I personally believe they would be more likely to act unethically when faced with the necessary survival of themselves or their practice. Secondly, Dr. Ruggiera had in the previous chapter reviewed how physically and mentally demanding the schedule of a surgeon can be when faced with on-call commitments for the hospital. It seems to me that being employed by a hospital rather than private practice would provide a better work-life balance for a surgeon. The benefits to being an employed physician rather than private practice were never really detailed in this book. Finally, the argument that the employed physician could lead to decreased quality was summarized by the review of a patient's case that involved an error on the part of a physician who was employed by the hospital. While the review of the patient's case was disheartening, mistakes are made all the time, unfortunately, but rarely have anything to do with who's employed. We all know that mistakes can be made by anyone. It's not something that I see as left just to where the physician is employed. It does, however, lead to the next topic covered by Dr. Ruggiera, the increasing trend of hospitals to buy up private physician practices. I think it's important to note that the first thing covered in this topic is that it's mutually beneficial. Hospitals are able to employ more physicians, which retains market share by being able to refer patients who stay within their system. What are the benefits to the private practice physicians? Protection from the massive changes and charges introduced by the Affordable Care Act in 2010. When there was already a shift occurring to see more private practice becoming employed by hospitals, the Affordable Care Act came along and introduced more risk and uncertainty to the healthcare industry. While there are many exams and factors, the book really paints the clear picture that money and healthcare go hand in hand these days. It is nearly impossible for a surgeon to perform the duty to care for a patient in need without factoring into the cost of cutting. Dr. Ruggiera paints a clear picture of the factors that influence the care review. While healthcare is very fluid and the Affordable Care Act is likely to go through change in the near future, the cost of cutting serves as an excellent bird's eye view of the healthcare industry through the eyes of a surgeon. Thank you.